Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to everyone joining us here today. Oh, I'm excited. We've got a really hot one coming up here. We've got our Tongue Tie Symposium right around the corner, September 12th and 13th. For most of you, you know how I always say this because I want you to go to the website and check in with all the timeline there. Our websites are queued to know which country you're in, so they'll give you exactly what time it's running because it is a live event, and that's super important. It is a busy event, so clear your schedules for sure, like we all are doing in our lives as well. We've got 2 days jam-packed of 10 presentations. Can you believe that? I don't even know how we're going to squeeze them all in, but let me tell you, every year we do this, we are just filled up with so much knowledge. We feel empowered. We feel like we can go out and talk to our families. And that's what leads me to introduce to you our very special speaker who's here with us today. She's going to be joining us live for the presentation. And I'm excited to introduce you to Melanie Henstrom. Welcome, Melanie. It's good to have you here today.
Thank you so much. I feel so privileged to be able to be part of this. This is absolutely amazing opportunity, and I'm just super, super excited that we get to be part of the Gold Learning experience.
Yeah,
Hi.
absolutely. I know. And it is exciting. You can tell I'm excited. It's a powerhouse 2-day event, but it feels like it just feels like you really are getting filled up on the knowledge because we bring people from around the world. We've got some amazing experts. And of course, that includes you. But first of all, let's find out a little bit about you and where you are in the world. And don't forget to tell folks, because international folks are listening in today, Melanie. So tell them where you are exactly in the world. Okay.
You bet. So I'm in Boise, Idaho in the United States, and I have been here about 6 years. I actually got my training in Portland with some amazing people out there. It's one of the, I think, kind of tongue tie centers of the world there with Dr. Gahary. And so I lived there for 16 years and did my postpartum doula work for several years, and then decided to go into lactation. I'm a mom of 6, including twins, and a grandma of 3. So I definitely have a lot of experience in that realm, and we definitely, as a family, have benefited from knowing the knowledge of tongue ties, and a good portion of my family has been released, and we've seen major benefits from that.
Wow, that's amazing. So lending your skills in there and learning as you go, I imagine, with your little ones too, which is wonderful. That's wonderful. So Melanie, I wanted to ask you a little bit about your earlier career. And I know you have a larger family, and we're not going to dispute that. I have a large family as well. So, and that keeps us pretty tied up for many years. I'm sure you were working with them hand in hand, but prior to that, what were you doing, or had you thought about what you wanted to do? I just really want to know, like, how did this all come about for you that you landed where you are here today?
Yeah, so I was a stay-at-home mom for many, many years, about 16 years, I think it was, before I got into the birth community. I grew up actually watching my dad deliver babies. He was an OBGYN.
Oh,
And
cool.
every once in a while, if I happened to be in the car with him when he got a call, he would, ask the mom if I could come in. So I got to see a few deliveries even as a young child. Well, he was probably closer to a teenager-ish age, but I definitely was introduced early on, and kind of had a desire and passion to be in that realm. I ended up working in adoption right after I graduated from Brigham Young University. And then I started my family, and I stayed a stay-at-home mom for many, many years. And once my children grew up and were in school full time, I decided that I needed to do something. I had been taking care of little people for so many years that I actually got depressed. I had to figure something out. So I did postpartum doula work for several years, and then really felt compelled to look into lactation, which is when I started, and went back to school and got my IBCLC.
Oh, that's fantastic. So you've had quite a journey, and I'm sure some of your experiences also support your clients and understanding and knowledge. Like many of us, we learn sometimes as we go, but also from our personal experiences, we can then, it becomes so relatable and relational in our work as well.
Absolutely.
So tell me about your current situation, and what does day to day look like for you right now in Boise, Idaho?
So my youngest is actually going away to college this week. We're
Oh,
going to
wow.
become empty nesters, which seems so wild, but because of that, I actually, for the last few years, have been working full time. He's been in high school. I'm a self-sufficient, good kid. So I felt pretty confident that I can work full time. And I have my own practice. I have a beautiful clinic in Boise area and see moms from all over the valley. And usually I'm seeing anywhere from 6 to 10 moms a day, moms and babies. And I have training in infant massage, craniosacral therapy, rhythmic movements. I'm going in for craniofacial therapy in October. So I teach the parents a lot of body work to do on
Mm.
their babies daily because we can't afford time wise or money wise to go see the body workers all the time. So we do a lot of training in the visits and give them videos that they can do at home. And so that's been super successful in helping these babies to move and feed better and be happier and sleep better. And then, yeah, I actually assist Dr. Zink on Tuesdays usually with releases. And so those parents that want to choose to do a release, we do those usually on Tuesday. And then I do all of the follow-ups for wound management.
Oh, wow. So, I mean, it just sounds busy. It's busy. You have
It's very,
lots.
it is very, very busy, but it's good work, and it's
Yeah.
wonderful to see how much better these breastfeeding dyads thrive.
Oh, that's wonderful. That's wonderful. Well, I mean, sometimes busy can be good problems, and it sounds like you are solving those problems.
Yes,
So that's wonderful. I wanted to jump into your presentation, and I'm just reading the title here in case you're wondering what I'm looking at: Case Studies of Missed Tongue Ties and Subsequent Consequences. So tell me a little bit about the topic. What was of interest to you, and sort of maybe a little teaser for folks who are coming in to listen for those 2 days as well.
sure. So really, I've been doing presentations quite a bit over the years in different situations, and I got an exciting call from Fiona herself one day asking me to present doing case studies, and I was like, "Did I apply? I don't remember applying." And she's like, "No, I saw what what you're doing on your website, and I really wanted to see what's going on." So I was thrilled that, and I knew exactly who you were when you called. So I'm like, why is she calling me? But that was exciting. Anyway, so we have been doing some things that I think a lot of other providers are not doing that
Mm,
is been life changing for a lot of these families. So most people, when they're doing a release, it's not always a full release. Even if we do have a diamond shaped wound, sometimes we also have additional fascia behind that.
mm,
And that is so crucial in having more optimal results with these babies, decreasing reattachment, and just better movement and better results. Decrease of symptoms and whatnot. So the actual presentation, we're going to go over multiple cases of how this has helped different families, and most of them were ones that most people would say were not even tied in the first place. In fact, one of the babies that I worked with, that is a baby with Down syndrome, we thought, well, certainly, the low tone and his syndrome is affecting his ability to feed. And I actually
right.
really liked under his tongue. And yet, getting, after we did the release, because mom really wanted to, it was life changing and his breastfeeding improved tremendously.
Wow.
So, and we work with a lot of babies with NG tubes, trying to avoid G tubes. We've gotten several babies off G tubes. So it's been a really amazing thing to see this be able to help these families so tremendously.
Excellent. Well, that sounds very exciting. There's nothing better, actually, I think, for many of us, and I speak for many folks that have come before me who worked with us here at Gold Learning, that we love the case studies because it really gives us an insight into what to look for, how to work through some of the challenges, how to troubleshoot, be a good detective, all the things. And when we do it together as a team, it just opens up so much more conversation and understanding. Because for some of us, we work alone or we're pretty isolated. So having these briefings, case studies, and then debriefings just is super exciting and challenging And I think overall very helpful for our continuing education. So I'm looking forward, to you having deliver these cases to us, and as we get an opportunity to discuss them with you. And that's really the opportunity here, because you're going to be with us live on the day, right?
Right.
So
Absolutely.
so you'll have a chance to also answer some questions and speak with the participants that will be there on the day. So if you're looking forward to being part of our tongue tie symposium this year, know that Melanie is going to be here with us live, and we'll have a great opportunity to sit down live with you and also do your Q&A as well. So we'll have, I think, lots of time, right? Hopefully.
Right. Yes.
Yeah. And I say that because I tell you, Melanie's got a jam-packed presentation. You are not going to want to miss a beat at all in this. So do come with great visuals and graphics. Thank you so much for, again, putting that effort into your presentation here, Melanie. I having a little bit of an inside scoop already is awesome, but I'm telling folks right now, come, and you're not going to be disappointed. So
Well,
thank you.
thank you so much. I
Yeah.
appreciate that.
Yeah. Well, thank you for joining me here today. This has just flown by so quickly. I'm looking forward to having more conversation with you in the near
Absolutely.
future. And of course, for all of our friends who are listening in right now, you can head over to the website at goldlearning.com to register for this event if you haven't done so already. Lots of opportunity of learning. Like I said, this is really actually a very big 2-day symposium, 10 presentations in total. You're not going to be disappointed. Keep up to date. That is the most important key value here. We all are trying our best to maintain evidence-based and also understanding what's happening in the community, because this is it's sometimes challenging area of our work, as we have to reach into the community. But every year I know the demand is there for this amazing symposium, and I'm so glad that you're going to be a part of it this year. So thank you, Melanie.
Thank you so much. I appreciate it.
Yeah, thanks for joining me here today, everyone. And I'll look forward to seeing you online. Don't forget, it's goldlearning.com, and for September 12th and 13th. And if you can't make it on those days, don't worry, it'll all be recorded for your convenience, and you'll have access for 8 weeks in order to enjoy those presentations. We'll look forward to seeing you all very soon. Thank you again. Bye-bye for now, everyone.
Bye-bye.